Submitting your bills to Christian Healthcare Ministries, or CHM, is not hard, but it is different. It is a simple process if you follow the steps we're about to discuss. My first suggestion is that you have a folder on your computer, a file, a box, or some kind of a container that you put all your bills into so you know where they are. For me, this simple trick sometimes makes the difference between me knowing where all the bills are and not being able to find a stray bill. First, make sure your healthcare providers know to bill you directly, and make sure they know you need an itemized bill. Now, an itemized bill contains 5 pieces of information: the patient's name, the date of service, the place of service, procedural code, or the CPT codes, which is a description of what they did, and the charge for each service provided, including the discounts. If obtaining an itemized bill is a challenge, CHM loves to get the standardized billing form, which the provider normally would send to an insurance company. These forms have all the information that I just mentioned, and your doctor or hospital will know what these are. Standardized billing forms are a CMS 1450 or a UB04 from your hospital, and a CMS 1500, formerly called a HCFA or HCFA 1500, which comes from your doctor. If you're on Medicare, all we want you to send CHM is a copy of your Medicare summary notice, which is equivalent to the explanation of benefits form that an insurance company would send you. With this, we do not need your itemized bills. To be sure, if you get prescriptions, they will not be on your Medicare summary statement, so those you would send additionally. The second item we need all members with medical bills to send to CHM are completed needs processing forms. These forms are found on our website at chministries.org/needs forms. The forms in the packet are the needs processing form, the needs processing worksheet, the HIPAA compliant medical release form, and a letter of explanation. Now, we don't need to know that you had measles when you were 3. Just, I stepped off the porch, I turned my ankle, I broke my leg. Now, in some cases where pre-existing conditions are involved, you will also send the prayer page request form. Please understand that CHM can't share or even process your medical bills until we have received your itemized medical bills or that Medicare summary notice and the completed needs processing forms. Your provider will not talk to us about discounts until we show them the medical release form. So these are all important. After you receive your itemized bills, immediately send a copy to CHM along with your needs processing forms, even if you're waiting to hear back from your healthcare provider about a discount on your bills. Also, to be shared, bills must be received at CHM within 6 months of the date of service, because if the bills get too old, the providers will not negotiate for discounts. To submit your bills and paperwork to CHM, you can do any of the following. Send them by mail. Our address appears on all of the needs processing forms, or fax them to 330-848-4322 or 330-848-2166 or 330-798-8041, or submit them online through CHM's secure member portal. You might prefer sending your documents through the member portal because you'll see immediate confirmation that we received them. To use the portal, follow these steps. Go to chministries.org/members and log into your account. Under Medical Needs, in the main menu, click Submit Medical Need Online. Follow the instructions on the page for downloading the blank needs processing forms and uploading the completed forms. When you're finished, click View Document Submitted Online in the main menu. In the portal main menu, you'll see a sample medical bill log which you can download and use to keep track of your medical bills, healthcare providers, important dates, and any payments that you have made. As soon as we receive your bills, we begin working on them. There are many things we must do before they are ready for sharing or paying. We must scan them into a PDF file. Then we physically translate the data from the PDF file into digital form within our operating program. Then an authorizer reviews the data to be sure that it's not a duplicate. Sometimes providers will bill for the exact same services on different bills for different facilities. That happens very frequently. Bills are then reviewed to determine the eligibility based on the membership level and the date of service. And the list goes on. Then your bills move to the member advocate department. There, they negotiate with the providers for discounts. Now, this step alone can take weeks while we wait to hear back from the providers. Then to member reimbursement for the final audit before sending you the check. This is just a few of the things we have to do, and all of this takes time. CHM sharing time is currently 90 to 120 days from the date we receive your bills here in our offices. We are always working diligently and effectively to significantly shorten sharing time. We're adding new employees and new processes that are making us more efficient and more productive. We will not rest until we accomplish our goal of shortening sharing time. Be sure to notify CHM if the bills you submit have a large discount of 40% or more. If you receive additional discounts after submitting your bills, and if your healthcare provider sets a deadline on your discount, this will affect your sharing time. We hope this information is helpful. Our purpose is to glorify God by serving His people, and we are grateful for the privilege of serving you through this ministry.